Madam Deputy Speaker, with permission, I'd like to make a statement on the pandemic. The Omicron variant is continuing to spread here and around the world. According to the latest data, there are now 261 confirmed cases in England, 71 in Scotland, and 4 in Wales, bringing the total number of confirmed cases across the UK to 336. This includes cases with no links to international travel, so we can conclude that there is now community transmission across multiple regions of England. Beyond our shores, confirmed Omicron cases have now been reported in 52 countries, with 11 countries that include Romania, Mexico, and Chile all reporting their first cases this weekend. This is a global battle, and we are playing a leading role. On Friday, I spoke with the Director General of the World Health Organization to share our findings so far and discuss how we can work together to tackle this common threat. We're learning more about this new variant all the time. Recent analysis from the UK Health Security Agency suggests that the window between infection and infectiousness may be shorter for the Omicron variant than for the Delta variant. But we don't yet have a complete picture of whether Omicron causes more severe disease or indeed how it interacts with the vaccines. And so we can't say for certain at this point whether Omicron has the potential to knock us off our road to recovery. Madam Deputy Speaker, we are leaving nothing to chance. Our strategy is to buy ourselves time and to strengthen our defences, while our world-leading scientists assess this new variant and what it means for our fight against COVID-19. And so today, I'd like to update the House on some of the latest measures that we are taking. First, we're taking balanced and proportionate measures at the border to slow the incursion of the new variant from abroad. We've seen with previous new variants how strong defences at the border, combined with the capacity we've built for genomic sequencing, can give us the best possible chance of identifying and responding to new variants. This includes our travel red list, which allows us to react quickly through targeted measures when the data shows cause for concern. Analysis from UK HSA shows that at least 21 Omicron cases in England alone are linked to travel from Nigeria, and there's a strong indication that Omicron is present there. Nigeria also has very strong travel links with South Africa, and it's the second most popular flight destination from Johannesburg. Based on this evidence, we've made the decision to add Nigeria to the travel red list, and this came into force at 4 a.m. this morning. This means that anyone who's not a UK or Irish citizen or a UK resident who's been in Nigeria for the past 10 days will be refused entry. Those who are, they must isolate in a government-approved facility for 10 days where they will take 2 PCR tests. I know that there's been a spike in demand for these facilities due to the rapid expansion of the red list, and that some people have experienced issues returning home. However, we are ramping up this capacity as quickly as possible. We've already brought several new hotels on board in the past few days, and we expect to double the number of rooms that are available this week. Madam Deputy Speaker, when this new variant is appearing in more and more countries every day, we also need to look beyond the red list and strengthen our measures for a wider range of travellers to make sure they give us the protection we need against this potential threat. UKHSA's findings that Omicron may have a shorter window between infection and infectiousness mean that pre-departure testing could have a greater role to play in identifying positive cases before travel. As a result of this new data and the greater spread of Omicron across the globe, from 4 a.m. tomorrow, anyone travelling to the UK from countries that are not on the red list must also show proof of a negative PCR or lateral flow test. This applies to any vaccinated travellers, so whether you're vaccinated or unvaccinated, at anyone aged 12 and above. They should take tests as soon as possible to when they depart, but no earlier than 48 hours before. I know that these measures, of course, they will bring disruption, and that they will impact people's plans to spend time with their loved ones, especially over this festive period. But we're taking this early action now so we don't have to take tougher action later on, and so that we can take every opportunity to prevent more cases from arriving in our country. I'd like to reinforce to honourable members that these are temporary measures while we improve our understanding of this new variant. We'll be reviewing these measures along with other temporary measures that we've announced, and we will update the House next week. I firmly believe that whenever we put in place curbs on people's freedoms, we must make sure that they are absolutely necessary. And I can assure the House that we won't keep these measures in place for a day longer than we have to. Second, Madam Deputy Speaker, as well as acting to slow the incursion of the variant from abroad, we're also strengthening our vital defences here at home. Late last week, we had the brilliant news that another new treatment has been approved by the MHRA after it was found to have reduced hospitalisation and death in high-risk adults with symptomatic COVID-19 by 79%. Another defence, of course, is our vaccination programme. On Saturday, we recorded almost 450,000 booster jabs in a single day, and yesterday, we announced that we'd hit the significant milestone of 20 million booster doses and third doses across the United Kingdom. In the last week, the UK booster programme has reached more people than the adult population of Greater Manchester, and we are expanding this life-saving programme even further as part of our target of offering all adults in England a COVID-19 booster jab by the end of January. To put this plan into action, we'll be recruiting 10,000 more paid vaccinators. We're also deploying about 350 military personnel in England this week to support the vaccine booster programme, and there's already over 100 personnel deployed in Scotland supporting their vaccination efforts. We'll have over 1,500 pharmacy sites putting jabs into arms across England, along with new hospital hubs and new vaccination centres. We're bolstering our booster programme so that we can protect as many people as possible, strengthening our collective defences as this virus goes on the advance this winter.